Welcome, future clinicians, to a focused and practical look at one of the most essential foundations of the periodontium, gingiva anatomy. The gum tissues are not just soft pink borders around the teeth, they are vital, functional structures that protect, support, and anchor your entire dentition. A strong understanding of gingival anatomy is absolutely non-negotiable for accurate diagnosis, successful treatment, and long-term periodontal health. Let's begin with a simple but important question. What exactly is the gingiva? The gingiva is the gum tissue composed of dense, fibrous connective tissue, all covered by a protective mucous membrane. Its primary job is straightforward yet crucial. It surrounds and protects the base of the teeth, acting as the first line of defense for the deeper structures of the periodontium. Without healthy gingiva, the entire foundation of oral health becomes compromised. To appreciate the gingiva's importance, we need to look at its key features. Though it may appear delicate, the gingiva is a highly specialized and resilient tissue. First, it is richly vascularized, which means it has an excellent blood supply. This supports rapid healing and provides strong immune defense. Second, it has a firm structural composition, created by a blend of connective tissue and epithelial tissue that makes it durable. And finally, much of the gingiva is firmly attached to the underlying alveolar bone, providing stability and helping maintain the integrity of the periodontium. Now let's break the gingiva into its clinical components, starting with the free gingiva. Definition: this is the collar-like ring of tissue that surrounds the tooth crown but does not attach to it. Function: it is separated from the enamel by the gingival sulcus, a V-shaped space you will frequently probe during periodontal examination. Because the free gingiva is movable, any changes in its contour, color, or sulcus depth become important indicators of periodontal health. This area is often the first to show signs of inflammation. The gingival margin is another essential landmark. Definition: it is simply the visible edge of the gingiva where it meets the crown of the tooth. Function: the margin plays a major role in both aesthetics and clinical evaluation. Shifts in the gingival margin, whether due to recession, swelling, or inflammation, are immediate signs of gingival or periodontal disease and are key diagnostic clues for every clinician. Moving apically, we reach the attached gingiva. Definition: this region is firmly bound to both the cementum of the tooth and the underlying alveolar bone through dense collagen fibers. Function: because of this strong attachment, the tissue remains stable during activities such as chewing and brushing. It acts as a tough, immovable anchor that helps absorb mechanical forces and maintain structural integrity. Adequate width of attached gingiva is essential for long-term periodontal health. Now let's connect anatomy to real-world clinical practice. Understanding gingival anatomy has a direct impact on daily patient care. The gingiva forms a tight sealing barrier around the tooth, preventing bacteria from penetrating deeper tissues. It protects the underlying bone, periodontal ligament, and root surfaces during mastication. And importantly, it contributes to aesthetics. Healthy, well-contoured gingiva is essential for a natural and pleasing smile. Mastering these details ensures that you can diagnose problems early, treat effectively, and maintain long-term periodontal stability. Here is our final interactive question for you. Think back to the function of the free gingiva, that unattached collar-like tissue. If the free gingiva becomes inflamed, what fundamental periodontal condition might begin to develop? Take a moment to think about it. The correct answer is gingivitis. Inflammation limited to the gingiva, especially the free gingiva and the gingival margin, is the defining feature of gingivitis. If not addressed early, this inflammation can progress deeper, damage the junctional epithelium, and evolution into periodontitis, where the destruction becomes irreversible. Your ability to detect early gingival inflammation is one of the most important skills you will develop as clinicians. Many of you might be feeling exactly like this: confused, overwhelmed, and wondering, where should I get all these services from? With so many responsibilities in healthcare billing, verification, documentation, revenue cycle, and more, it's natural to feel stuck. So if you're feeling that confusion, you're not alone. Every future dentist eventually asks the same question: who can handle all this so I can focus on dentistry? That's exactly where Qiaben Health steps in. As you move forward in your dental career, clinical skills are crucial, but efficient practice management is just as important. Qiaben Health brings together everything a modern practice needs, all in one place. First, Qiaben EMR and Telehealth. In a digital-first world, managing patients efficiently is essential. Qiaben offers streamlined tools for appointments, charting, and virtual consultations, making daily workflow smoother and saving valuable time. Next, medical billing and coding. Every clinic depends on accurate billing. Qiaben Health provides compliant, real-time billing and coding support so your claims are processed correctly and reimbursements come without unnecessary delays. Then, insurance verification and pre-authorization, one of the biggest sources of stress for clinics. Qiaben delivers fast, reliable verification services that reduce claim denials and eliminate those administrative bottlenecks that slow practices down. And finally, reducing operational costs by up to 50%. With automated processes and smart workflows, Qiaben helps clinics save money, time, and resources, allowing you to focus on what matters most, delivering great patient care. So the answer to your earlier question, where should I get all these services from, is simple: Qiaben Health, your one partner for smooth, efficient, future-ready practice management. Thank you for joining this focused exploration of gingiva anatomy. Remember this key message: your understanding of gingiva is the foundation for accurate diagnosis and effective periodontal treatment. A healthy periodontium begins with a healthy, well-maintained gum line, and your clinical decisions play a vital role in achieving that. Wishing you success as you continue your journey toward becoming skilled and confident dental professionals.